Yay. All right. Well, welcome everyone. This is our Q&A session. We do this about every other month. So if you missed this one, come join the next one, or come join the next one anyway, because there's always new questions that people are asking. We also do record, as you just noticed, and so you can always rewatch any of the Q&A sessions. They are always available. I believe you can just find them on our YouTube channel. But welcome, and I'm Laura Santner. And I've been working with BFRBs for quite a long time now. So I will go over your questions and answer them as best I can. And what I'll be doing is I'll be going over the most commonly asked questions and then the pre-submitted questions first. And then I will go to your live questions. So again, if you have a question, just write it in the, type it in the Q&A box. Okay, so this is a pretty casual Q&A session. Relax, get some water, make sure you got some fidgets. I have this fidget ring, these spinner rings. I really like fidgets that are discreet. This is another little fidget ring. And then I wore a magnetic necklace to show you guys another little fun fidget. I love magnets. It's got that nice like pull apart feeling. All right, so let me get started with your so common asked questions and pre-submitted questions first, and then I'll jump to your live questions. So what causes BFRBs? The cause is not entirely known. I wish it was more known, but it's rather complex. But what we know is that research indicates that most people have this inherited predisposition. So that means there's a very large genetic component. In addition to the genetic component, there are other factors. So it's not just genetics. So other factors such as hormones, your temperament, the age of onset, any other co-occurring disorders, environmental stress factors. So it's not just one of these things that's going to cause a BFRB, it's that combination. So even if you have, let's say, a genetic predisposition, it does not mean you are going to wind up developing a BFRB. Okay. What kind of therapists do I look for? So the best kind of therapist is one that's trained, trained to work specifically with BFRBs. So you can find a trained therapist through a couple of lists. So right now there's lists on skinpick.com, on trickstop.com, on bfrb.org. There are some other organizations that are starting to develop lists as well. And those lists are really helpful because those are the ones that are trained and knowledgeable. And you want to look for, if you're talking to therapists, some things to look out for are the modalities that they use. So you want to look for ones that are familiar with the comprehensive behavioral model, also the COMB, COMB. You might see that written somewhere. Acceptance and commitment therapy, or ACT, habit reversal training, HRT, cognitive behavioral therapy, which is CBT, and dialectical and behavioral therapy, that's DBT. So you want to look for therapists that at least are mentioning some of those things, or a combination of those things. Both the SkinPick and the TrickStop program have all trained and knowledgeable therapists. So it's a really great resource if you are in an area where you don't have a therapist that's trained and is accessible. So something to take into consideration if you need. The most important thing when looking for a therapist, though, is to make sure that you're comfortable with them and that you connect with them. So I would say, out of everything, that's the number one. If you are not comfortable with your therapist and you do not connect, it's not going to work. Okay. Is this a lifelong struggle, or is it possible to stop? So BFRBs, or body focused repetitive behaviors, that is a chronic disorder, unfortunately. So what that means is that there is no cure, and that it is lifelong. However, that does not mean that it is going to be active your entire life. So there can be periods or long stretches of time where it becomes dormant, where you learn strategies, those urges go away, you're able to manage them, and it no longer interferes, and you're good to go. So, um, the more you learn, the better prepared you'll be for when those urges do pop up or when they do become active, if they ever become active again. So, if they kind of become dormant, and then get reactivated, because sometimes that happens, you'll be able to better manage them. So, yes, lifelong, but it doesn't mean it's always going to be active and always interfere. Okay, hope that answers that question. Again, if anyone has additional questions or needs clarification, just write in the Q&A box, and we can always revisit things. Okay. What is NAC? Is it helpful? Is there a recommended brand, and what is the recommended dose? So, if you are considering taking NAC, it stands for N-acetylcysteine. Please consult with your doctor first. It is the only FDA approved, medication so far. It's not an actual medication; it's an amino acid supplement. So it is one that's showing the most promise, which is pretty exciting. Um, the brand that's most and people are saying that it's there's a mix. Some people say that it's quite helpful, and some people feel no effect. So I always say it's worth trying, because there are very little to no side effects. So the recommended brand, the one that was researched, is the brand Swanson. So that's typically the number one recommended, just because that's the company that was cooperative with the research. Um, there are lots of brands, and every brand might work a little bit different as well. So I would start off with Swanson if you can. Um, I don't know the other brands. I do know the brand Now, and I do like the brand Now as an alternative brand. So I would say Swanson and Now would be my top two. Um, the recommended dose. So they recommend starting with 1,200 milligrams, and broken up, into two. So 600 milligrams, let's say in the morning, and 600 milligrams in the evening. And it's recommended to take them around times when you, typically have stronger urges, because they are, short lasting. So they typically stay within the system about 8 to 10 hours. Um, but for some people, it might be more like 3 to 5. So still more is need to be known, more needs to be researched, but that's why it's recommended to split it up. So you can try 600 right in the morning, 600 in the evening. You can go up to, what was studied was up to 2,400 milligrams. So again, you can break that up into smaller doses and see how that goes for you. Um, it can go more than 2,400. I think there's some research that shows that there's promise for some higher doses, but that it wasn't actually researched. So right now it's recommended up to 2,400, but it can go beyond. 2,400 was just the max that was studied, so that is why it is recommended. Um, Is NAC effective for skin picking in along with psychological treatment? Is it safe for children? So yeah, so NAC, N-acetylcysteine, right now is the most effective, medication, right? It's a supplement so far. So it's just an amino acid supplement. It's basically kind of like a vitamin, that delivers amino acid. It's shown that a lot of folks with BFRBs are kind of lacking in amino acids. There's a lot of different amino acid studies, so something to check out. So what's great about it is, because it's a supplement, there's very little to no side effects. So yes, it is safe for children. I would still consult with your doctor. Don't just go to the pharmacy and get over the counter NAC. I would still just consult with someone first, and start off with that low dose. Um, there is no medication or supplement that's going to have that magic answer, unfortunately. So it is about that combination. So is it effective along with psychological treatment? Yes. It is most effective. Anything is most effective with a combination of things. Nothing alone is going to work or be helpful. Okay. All right. Let's see. Are there common triggers I can avoid? And what can I do to manage these urges? So there are a lot of potential triggers, as you may have already noticed. So, I always suggest to do tracking first. So, tracking or doing some self monitoring. And that's going to help you to learn what your common triggers are. Everyone's going to have a different trigger. Certainly, there are common ones, but tracking will kind of help you to figure out what it is for you. Okay, so um, I do recommend starting off doing some tracking just so you can get that information for yourself. Typically, triggers occur when you're overstimulated. So, for example, when you're like stressed, anxious, overwhelmed, or understimulated. So, boredom is a really big trigger. Okay. Triggers also range. For example, sensory triggers, right? How hair or skin like looks and feels. Cognitive triggers, so what are you thinking? What are you telling yourself? Affective triggers, how are you feeling, right? Motor triggers, so your like body position and place. Where are you located? Like, are you in the bathroom? Are you in front of mirrors? Are you lying in bed? Okay, so those are some other triggers to kind of be on your radar. So, depending on the trigger and the situation that you learn about through your tracking, it will help you to navigate what direction you want to go in as far as management. So, for example, if one of your triggers is sensory, you can experiment with different fidgets, right? Different sensory fidgets, right? Fidgets. Um, Cognitive, if that's a big trigger for you, your thoughts, you can be mindful about some of the things that you're telling yourself. How could you rephrase things, okay, to address some of those thoughts? Um, Affective triggers, how you're feeling. So, strategies to help you cope and express those feelings. So, for example, just breathing, relaxing, exercising, writing, art, music, going for a walk. Those are some things that will help your feelings, right? Motor strategies. So, if motor is a big trigger for you, um, your movement, I always like to recommend strategies that help to block yourself, right? So, blocking yourself using gloves. I like scotch tape on the fingertips or band aids, but band aids on areas, band aids on the fingertips, long sleeves, hats, scarves, tights, um, things like that. Even yeah, anything that's going to block you um, is what I would recommend for motor. Okay, um, place. So place strategy. So place is like if you're notice that you're picking or pulling while watching TV, right? And you sit in the same spot every time you watch TV. So a place strategy would be move to a different spot, move to a different chair, sit on the floor, change your position. Uh, if you pick or pull in front of the mirror, right? Think about covering the mirror. Think about changing the lighting in the bathroom. So, what can you do to change or adjust your environment? Um, it could be something really simple and it winds up making a big difference. Okay. Let me see. Did I answer that question? Are there any? What are the common triggers I can avoid and what can I do to manage these urges? Yeah. So, think about that. And if you need more specific ideas, I mean, again, check out, I think I did for sensory strategies in particular, I did a whole webinar on that. So you can check that out. consider joining the program. The program goes into a little bit more detail about all of these different factors. Okay. Um, oh, yeah. Why is it that when one BFRB, such as trick, is under control, another, such as skin picking, seems to flare up? Why is it so hard to tackle both at the same time? Yes, it is really hard. um, that's the truth. And this is a common experience. Yes, this does happen. um those urges are loud, they're loud, they're sneaky, and they want your attention, they want to be heard. So what happens is when you are able to manage one area, um those urges are trying to tell you something. So it's telling you that its need is not being met yet, and it wants your attention, and it's shouting at you, and it's going to pop up in another way until you pay attention to it. So yes, the fun journey of managing BFRBs, right? When you think you got a handle of it, it pops up in another way. But luckily, strategies for trick, for example, are mostly the same strategies for skin picking. So you can still use all of your strategies, but it does take a little bit more experimenting of what to do when, what combination, right? In what situation. Um, and it's frustrating. It's frustrating. But hang in there. Okay. And see if you can figure out what your body is trying to tell you. So take that pause and, okay, I have urges right now and it popped up in this way. What is it saying? I like to think of it as your urges are like your body is speaking another language. Okay. And we don't speak that language, and we have to try to figure out what it's trying to say so that you can have a conversation. Okay. Good. I see questions are coming in. I can't wait to get to your live questions. We have a couple more of the pre-submitted ones, and then I'll go right to your live ones. Um, let's see, what did I do? Yes. What what are the most common competing responses that actually work for people with trick? Yeah, so I find this question interesting because there isn't really an answer, unfortunately, um, because there is no most common competing response, because everyone is different and different things are going to work with different people and in different situations. Um, in addition, just doing a competing response is not going to work. You have to figure out that combination of things. So doing a competing response along with a stimulus control strategy, for example. So um, it's just in addition to other things, right? So it's just that like magic combination of strategies that will be most helpful. So there is no like one competing response. Um, it's more about understanding like what is happening in each situation. So what are you thinking? What are you feeling? What is your body trying to tell you? Right? What do you need? And then you can think about which strategies will best address those needs and which combination will best address those needs. So there are many competing response options. There are many lists, there are many ideas. But again, there's not going to be just one that's going to be helpful. And it just, again, depends on each situation and what you like and what you don't like. So you're not going to know unless you try different things. And something to keep in mind is that one strategy may work one day and in one situation, and you may be really excited, but then it might not work another day or in another situation. Um, so that's fun, right? How do you know what's working and what's not? So really, anytime you use a strategy, it's an opportunity to practice, and it's working. Whether find one that's working in each moment, and then that's going to be helpful for every moment that you can delay picking or pulling. That's helpful. Okay, so I hope that was helpful. again, please type in any follow-up questions. And I'm going to move on. I think we got a couple more. Yes. What are the most, oh wait, I just did that one. My my 6-year-old granddaughter is now picking her skin and getting scars. She's open for treatment. How would you approach a 6-year-old? Yeah, so that's really great that she's open to treatment and interested in learning more about her skin picking and BFRBs. Um, at 6 years old, it's young, which is fine, but it just means that her ability to follow through with strategies and practice is going to be a little bit limited. So she is going to need a lot of additional support. So, what I would recommend is for like parent or grandparent to be kind of the main ones to get the support so that they can pass the information along to the 6-year-old. Um, so for example, SkinPick well, this is for skin picking. So SkinPick has a parent program. TrickStop also has a parent program, and so I would actually recommend something like that because that way the adult, the caregiver, can get the information and then filter what's appropriate to the 6-year-old and help. And you can do it together. So that way um, the 6-year-old is less likely to get so overwhelmed and you're just doing a little bit at a time. And you could make it fun and exciting. So for example, when doing, for everyone, we always recommend like charting and tracking in the beginning to learn about your pattern. So when you're doing that with a 6-year-old, like make it fun, make it into a game. And then when you're practicing strategies, use the reward system for using strategies, stickers, fun colors. So things like that. Okay. The actual, material is going to be the same for a 6-year-old and for an adult, but it's the delivery. Keep in mind also, at six, scars are going to heal. So if you're seeing scars, don't worry about them too much. Don't focus too much. They will heal. They'll be okay. Um, she's got she's got lots of times to practice and learn strategies, and she's very lucky to have the support of a grandparent in this situation, so she'll be okay. It's no one's fault. It's not her fault. It's not your fault. um, and she'll get there. Okay. Can you help those of us with scalp psoriasis? This has been an issue for the last 7 years. I have seen 5 different dermatologists over this period of time and tried many topical treatments. I admit to being 90% of the problem. No, I admit, mm-mm, you are not 90% of the problem. Although the itch is not severe, the texture of my scalp bothers me and I do scratch a lot. Okay, yep, fingers crossed that you will have some valuable suggestions. So, yeah, this can be really frustrating. Psoriasis is definitely a really common sensory trigger. Um, so you are certainly not alone. You are on the right track because a dermatologist is the kind of doctor you would be seeing. So I'm surprised and I feel disheartened with you that you've seen so many dermatologists and nothing has been helpful so far. I'm wondering if they made additional suggestions besides topical creams, because there are more treatment options out there for psoriasis. So, for example, there are oral medications, there are medicated shampoos, there are even things like injections and light therapy. So, I hope that one of these dermatologists or a future dermatologist will kind of go over some of these options with you, and combination. Again, it's that combination of things. So doing just topical creams might not work, but doing topical and a medicated shampoo, um, and maybe an oral medication too. Maybe that combination would be better for you. You can experiment with some home remedies, but you'd have to look more into it and again consult with your dermatologist about it. So, for example, like coconut oil, diluted apple cider vinegar, Epsom salt baths, but consult with a dermatologist. So I don't have suggestions about what to do about the actual texture of the scalp and psoriasis treatment, but you can think about, excuse me, strategies to help with that behavior or of picking. Again, so barriers could be helpful in this situation, like hats, scarves, gloves. Um, you can also consider using other things to scratch. So, not your fingers, avoid using your fingers to scratch. Because when you use your fingers to scratch, you're stimulating the tips of your fingers too. So, that's going to increase urges. So, you want to scratch using other things. So, for example, you can use like a scalp massager. You can use a comb, a brush, even like the back of your like pen, right? So anything to scratch without using your hands and your fingers. Going to decrease that stimulation. So yeah, I would encourage you to try that. You can also just try some distraction strategies. So when you're feeling that itch and that discomfort, so things like drinking water, um, just doing some exercising, moving around, touching or massaging somewhere else on your body, pinching, squeezing, practicing some body scans, again, to really focus on other parts of the body. um, and maybe a good old fashioned stress ball just to kind of get some of that tension out when you feel that itch. Power and breathing. Don't forget to breathe. It's really interesting when you're feeling distress, physical or emotional distress, right? We tense up and um, our focus becomes heightened in that area that's making us tense. So when we breathe, kind of slows everything down and it kind of helps to settle things. So that itch might even go away or decrease when you kind of breathe it out. So try some of those things. Again, try a combination of those things. All right, I think, yes. So we have the last pre-submitted question. Do you have any book recommendations that would help? Yeah, so there's lots of books out there. I would say the number one book is called, let's see, Overcoming Body Focused Repetitive Behaviors, a Comprehensive Behavioral Treatment for Hair Pulling and Skin Picking. So I would say that's probably the top one. It's by Charles Mansueto, Sherry Mansfield, and Ruth Gollum. Um, there's also, this is a little bit older, but a goodie, Help for Hair Pullers, Understanding and Coping with Trichotillomania. That's Nancy Cuniff, Dan Stein, Gary Christensen. I also really like, again, this is a little bit older at this point, but there's a Trichotillomania and ACT Enhanced Behavioral Therapy Approach Workbook. And even though it says for trichotillomania, it works for skin picking as well. And that's a Douglas Woods and Michael Twohig book. There are two newer books, which are pretty exciting and promising. It's the BFRB Recovery Workbook, and that's Marla Deibler and Renee Renardi. And then the newest one that like just came out is called the BFRB Survival Guide, a workbook for overcoming body focused repetitive behavior. So that's by Susan Mouton Oden, Ruth Gollum, and Charles Mansueto. And you might see some of these names repeat, and some of these authors are like the head honchos of research in the field. So these are some good ones. Okay. So let me jump now to your live question and answers. Just moving things around on my screen. All right, so let's see. I'm afraid of long-term hair loss in certain spots. Does the hair regrow once I get better? Yes. hair regrows. Um, yeah, luckily, and it takes it takes a really, 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 really long time for it not to regrow, or for it to regrow um, thinner. And it also, again, depends on just your genetics as well. So most of the time, it grows back. You might notice that when it grows back, it might be a different thickness, a different color, a different texture, which can be frustrating. And that kind of works itself back out over time. So it takes a little bit of time for like the follicles to heal and regather itself. But yes, it grows back. If signs that it might not grow back are is if the area is shiny. Okay, shiny, and you stop seeing like basically like dots or indents where the hair grows from. But I wouldn't worry about it. It grows back. Okay. Oh yeah. So is there a good way to lighten scars or even get rid of them? So yeah, so I would consult with a dermatologist as well. There are lots of things you can do. Um, there's lots of different creams that you can use to try to lighten the scars. Depending on the scars, you can also use different silicone patches, um, which are really helpful for helping to heal scars. Um, they have things like, depending on the type of scars, like pimple patches, even something like that helps to medicate the area and to help with the area. Long-term treatment, there are things like laser to get rid of scars. Scars do heal. Um, Depending on where on the body they are, they do take a different amount of time to heal. So some heal faster than others. But yeah, there are lots of options. Okay. So just experiment and again, see what works for you and your skin type. And again, it's going to be a little bit different depending on where on the body it is. I take 1,200 milligrams daily. This is of NAC. And I've noticed a big difference. I just started taking it about 1 month ago. That's great. I'm so happy to hear that. Yeah, it's for some people, it really does make a difference. And it's kind of interesting. It kind of feels like, right, like a tension is left. You feel a little bit lighter, and it's a little bit easier to manage. You can breathe. It's like it's kind of like when you have urges, it's like your breath is being held, and when you take NAC, and if it's helpful for you, it feels like you can breathe again. So I'm happy to hear that that's working for you. Yeah. So someone asked this question, or in the pre-submitted question, should kids use NAC too? What about the brand and the doses of inositol? I think you must mean NAC and N-acetylcysteine. Um, if that's what you mean. As I mentioned before, yes, kids can use it as well. I would still consult with a doctor, but it is safe to use. It's just an amino acid supplement. It's got very little to no side effects. You can, if you're nervous, you can always start at even a lower dose. Start at 600 milligrams. Don't start at 1,200. Start at 600 and see how you like it and see how they like it and how they manage it. The brand, um, I, the one that was researched was Swanson, and the one that I'm familiar with is Now. So those are kind of my top two, but you can experiment and see what works for you guys and what is accessible. Okay. Hope that answers that question. Oh, yeah. So, how do I fight the urge to pull my hair when I don't know I'm doing it until I see the pile of hair on my lap? Yeah, really good question. So, the first step is definitely awareness. So, what you're describing is called automatic pulling, which means you're automatically doing it and you don't know you're doing it. You're unaware. So the first step is to have awareness, to increase that awareness. You are right. You are not going to be able to fight the urge if you're not aware of the urge. So, tracking. So, start to track. When you do tracking and self monitoring, that helps to increase your awareness. So, that brings it to the forefront and helps you to see what your patterns are, so that you could figure out how you could best manage. If you're still having trouble with the tracking and that automatic, it's still automatic and you're not quite getting it, I recommend, depending on where on your body you're pulling, I recommend certain devices that can help to increase the awareness. So the Keen Habit Aware bracelet is one that vibrates when you go to pick or pull a certain area of the body. So it kind of vibrates and it tells you, oh, look, your hand's there. So that really helps with increasing awareness. So using something like that, if you have a lot of automatic pulling, is a helpful tool. So that's called the Keen Habit Aware. I should add this question to my frequently asked question list. What is BFRB? Right. So first time here, I pull I pull out all my top eyelashes and have for 40 plus years. I mostly do it when they start poking me. Yeah, because they grow in crooked. Yep. I have even started pulling on the bottom too in the last few years. Yeah. So BFRB, body focused repetitive behaviors. So BFRB, body focused repetitive behaviors, includes things like skin picking, hair pulling, nail biting, lip and cheek chewing, for example. So those are all within the realm of BFRBs. And yeah, if you're an eyelash puller, yes, they tend to grow back crooked and they poke you and it can be uncomfortable. They do have some serums. I don't know which ones off the top of my head, that people find helpful to kind of, it soothes the lashes and it softens them, so it kind of helps them to not be so pokey when they grow back. So that could be something that you could look into, to see what works for you, because that like pokey feeling is uncomfortable and guess what, a trigger for more pulling. So I don't have, this is any recommendations for topical creams, oils for the skin discoloring or scarring. So I don't have any particular types of creams, or oils for that discoloring or scarring. You'll have to kind of experiment a little bit. Um, there are there are many options out there, so it's hard to really know. So you'll just have to, a little bit by trial and error. Um, you could go on, if it's not overwhelming, certain forums. So for example, there are certain Facebook forums you can join and ask what other people have used and tried. And so sometimes people might have a specific cream or oil that they recommend. Um, I forgot what the name of the top like scar cream is, but you can probably look it up. Or if you can't find what like there is like the 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 top one, the most commonly used one. If you can't find it, you can always email us, at support@skinpick.com, and I can see if I could find the name that I'm thinking of, which I'm blanking out on the name of it at the moment. Um, but look around, lots of options. Moderna. Wait, Moderna, I think, is the the topical cream that I'm thinking of. They might do creams and they might do patches as well. Yeah, I think it was Moderna. Um, and what's the other one? There's one more, but Moderna is the one that I was thinking of. Yeah, email us and if I remember the other name, I'll look it up and I'll let you know. Okay. Hi, my daughter has Down syndrome, autism, nonverbal, mild eczema. She is 22 and has had this problem. Oh, and has had this problem since she was 12. Yeah, 12 is the most common age, that this begins, actually. 12, 13, 14, right around puberty. She pulls or twists hair constantly, no stopping, sometimes pull free, pull full areas out, awake or asleep. Concerned that this started when she started using iPads in school and then more at home. Concern is the overstimulation, yep, of her nervous system. It stops her from sleeping. Ice has been a best relief. Yeah, that's a strategy. And vetiver oil. There's a vetiver Vetiver oil helps her sleep. We have started training with homeopathics, and we do natural health support. Oh, thanks. Sorry, this is a lot. Love to you all. Yeah, I'm sorry to hear this. This is definitely a combination of things that she has to struggle with. Um, so from her managing symptoms is going to be more challenging, um, unfortunately, because she's got to manage the Down syndrome and the autism and the eczema. I mean, out of um, and hair pulling. So out of all of these, I would actually say eczema is probably the simplest to treat, right? Um, because you have to find the right combination of medications to help with the eczema. Um, but yeah, she's got a lot of obstacles, that's for sure. But keep trying. Again, the same strategies for anyone else that would help with hair pulling, will work for her too, but it's just going to be a little bit harder to figure out which ones work and when. And it just might take more experimenting, and it probably will take more parent support as well, and parent guidance. Um, I would suggest maybe something that would be helpful for her um, would be barriers. Something like barriers would probably be on the easier side of the spectrum of strategies to use to try to block her, and just encouraging her to use different like fidgets. So barriers and fidgets might be helpful for her, and trying to um, help her find other ways to soothe herself, and do them with her. So doing other activities with her, doing massage, for example, going on a walk together, dancing, doing an art activity together. So doing things like that, but she'll have to follow your lead. Okay. My doctor said typical medications like SSRIs are not very effective for this disorder. That is correct. Aren't these behaviors linked to anxiety? No. And if so, why wouldn't addressing anxiety help to curb the behaviors? Yeah. So your doctor was correct. SSRIs are not effective for this disorder. This disorder is not linked to anxiety. It is something different. However, anxiety is a common co-occurring disorder. So if a person also has anxiety, then an SSRI might help with the anxiety. It's not going to help with the picking or the pulling, but it will help with the anxiety. If anxiety is really in the forefront of triggers for you, then a medication for anxiety you might really see some benefits for your urge to manage your urges. Um, but this behavior is not necessarily linked to anxiety. Um, Even though it is common, it is different. Okay, so yeah, so your doctor was right. Have you noticed in your practice that a lot of BFRBs are most activated at night, or is it more individual? Yeah, so nighttime, I would actually say, is one of the most common time that people experience urges, and that's because you're tired. You're at the end of the day, you have no more energy, so it's really hard to manage those urges when you're tired. And at the end of the day, you might also be stressed. Oh, that was such a hard day. And you just want to kind of relax. And how does the body want to relax? It picks or pulls because that's what it knows how to do. So finding other ways in the evening to help yourself wind down and relax. So So yes, it is one of the most common times. Um, I would say, yeah. Um, I'm happy to expand or explore further, but we'll leave it at that for now. Because I got lots more questions. We'll go to, I see it's like 12:45. We'll see how the questions go. Maybe we'll go to somewhere between 1 and 1:30. Oh yeah. So do you have any tracking templates? I do, yes. And both TrickStop and SkinPick does, but I'm not sure you can access that now unless you are in the program, because those tracking templates come along with therapist feedback. So I don't think you have access to that. Um, but you can, I mean, I could like send you mine, certainly, or you can just also Google. There's tons of tracking options out there. So for example, you can make your own. So you want to kind of track, um, the date, and was the urge like a little, medium, a lot? What was the situation where the urge was happening? What were your thoughts and feelings that were happening before? Did you pick or pull? Um, did you use a strategy? What strategy did you use? Was it helpful? Um, oh, like, oh, what time of day? So when I do tracking, I also like to track, for example, like morning, afternoon, evening, night. So I kind of like to separate it like that. So you're not tracking every single time you pick and pull. You're kind of doing like a summary track of those times of days. So that's helpful to see. Do you pick or pull a lot in the morning, right? Or while you're at work watching TV, or while you're home watching TV, or while you're at night in the bathroom, in the bed. So you want to know like what is happening, where it is happening, like your location, situation, and what you are trying to do about it. Oh, yeah, this is a good question too. So what is a good way to deal with the shame involved with skin picking? Yeah, I would recommend you go over to our website, or to our YouTube channel, because we have done a webinar on this topic. So you might find this very helpful. A topic specifically, the whole webinar just on this topic of shame. It's a big topic. So so check that out. The short version is that, having self-compassion. Have self-compassion with yourself. Do things that help you to feel good. When you wear things that help you to feel good, when you are engaged in activities that help you to feel good, that helps to decrease that sense of shame. The more you understand about your skin picking and BFRBs, the more you talk about it, the more you are involved with support groups, or with your therapist, or just talking about it with your friends, the more it gets out there, the more likely that shame is going to decrease as well. So that's the very short answer. But check out that webinar. I think that you'll like that. And if you have trouble finding that webinar, email again support@skinpick.com, and they can send you a direct link or something if you can't find it. Oh, yeah. Can you give an example of rephrasing what you are telling yourself in relation to hair pulling and picking? Oh, yeah. So, um, the common thought is I have to pick and pull right now, right? I have this urge and I have to pick and pull. So, rephrasing would be something like, I notice that I have an urge right now, and oh boy, it makes me want to pick and pull. That's a very simple rephrasing. Just adding that I'm noticing that, helps you to take that step back. Okay. When you're able to take that step back and see, oh, wait, no, I don't have to, I have an urge, I have to pick and pull. oh no, wait a second. Yes, I'm noticing an urge, but I don't have to pick and pull. I want to. I notice that the urge is really strong, and it leads me to wanting to pick and pull. Um, and then that leaves space for expanding it. Well, do I really want to? Well, yes, but also no. So, okay, well, I'm noticing that I want to because I'm uncomfortable. Okay, why am I uncomfortable? Let me take a walk instead. Let me go get a drink of water and then see how I feel. Okay, so just take that step back. Just that really simple, I notice that helps you to take a new perspective. I can give you many other examples of rephrasing, but I'm just going to leave it at there for now. And hopefully that will give you enough to start to experiment. What kind of hair growth tips do you have for head hair? Um, well, one is, you know, try not to pull your hair. Um, um, but other than that, there again, there's so many different products and tips. They say trying to stimulate the scalp, trying different um, paraben free hair conditioners, not washing your hair with shampoo. A lot of people wash their hair with shampoo too frequently. And, dermatologists have said that's actually too rough for the hair and it's not needed. So shampooing less and doing more conditioning um, has been shown to be helpful. Um, so it's just something simple like that is what I would recommend. Keep in mind that hair grows at different rates, and depending on where on the head, it also grows at different rates, which can be frustrating. So you might see growth, might have different lengths of hair. It might be growing differently. So, um, you know, besides besides that, you can use different kinds of hair growth serums. What I like about hair growth serums, I don't know if they actually do anything or not, but it helps you to feel like you're doing something and you're taking an active stance. And it's a method of self-care. So even if the product that you're using doesn't actually help with hair growth, the act of using a product is engaging in self-care, which helps you to relax, which helps you to pull less, which helps with hair growth. Um, so that kind of would be my recommendation of things to try. Okay. Yeah, when I feel the urge to pull my hair, my head starts to itch until I pull out that hair. Yeah, kind of like tingles, which seems to only make things worse. Yep. And ends up in a circle. Yep. How do I act against this? Yeah, it's this cycle, right? You feel this like tingle, this urge, this little itch, and then you go and you pull and you think it's going to relieve it, but no, it just makes that like tingle itch stronger and it becomes this cycle. Um, so similar, actually, what I suggested with the person with the psoriasis question is if you feel that tingle or that itch, see what you can do to avoid touching with your fingers, with your hands. So using a comb or a brush just to kind of, or a head massager to stimulate the scalp without using your fingers and without pulling. Um, and it's strangely pretty satisfying. So you can still stimulate the scalp without using your fingers and without pulling. So I would suggest that if you're having a hard time with that, maybe like if you can, pop on some gloves, again, a barrier, and then stimulate the scalp, either with your hand with the glove on or, using again that comb, that brush, even the back of your pen, right, to try to stimulate the scalp. Um, Try it. Oh, can you suggest fidgets that are suitable for men? Yeah, check out the I did a whole webinar on fidgets and it's for everyone, men and women. Certainly, things like wearable jewelry are not going to be so appealing to men. But maybe rings if it's your thing. Maybe certain like wearable bracelets, like fidget bracelets. There are certainly masculine ones out there if you are comfortable with that. So yeah, any fidgets. I'm just looking what's quickly next to me right here. Magnet is right next to me. Let's see, poppers. Again, check out that webinar. Any fidget is for everyone. So just kind of check out that webinar and see what interests you. I also did a giant list. I think it's called like the giant list of favored fiddles or something. So you can look through that giant list. That list is on BFRB.org, and you could go down the list and see out of all of those fidgets, which ones interest you and which ones you want to try. Okay, so check that out. Let me know. How does ACT work, or ACT? So acceptance and commitment therapy. So what that is it's basically, it's not accepting that you have a BFRB, that you have a disorder. It's not accepting that you're picking and pulling. That's not what it is. It is accepting that you have an uncomfortable feeling. It is accepting that, oh, I have an urge right now and it's really uncomfortable. So it's it's noticing that discomfort, and you're making a commitment despite that comfort to either sit with it for a little bit, or a willingness to problem solve. So willingness to sit with that discomfort, a willingness to think about how can I manage this discomfort. So that's kind of what acceptance and commitment therapy is about. It also involves a lot of work with values. So when you're starting to think about how can I manage this situation, this urge, what is aligned with my values? What do I enjoy? What makes me feel good? And how can I incorporate that into my daily life and how I manage urges? Okay, so that's that's a very brief, very brief overview. You know, I don't know if we've done a full webinar on this, but if that's something that interests you, again, email us and request it. We will always make a webinar on topics that interest you guys. So just let us know. So what is a competing response? So a competing response is basically doing another behavior that kind of goes against or opposite picking or pulling. So competing responses alone is not going to do anything. Again, it's that combination of strategies. So an example of a competing response is, instead of picking or pulling, is make a fist, right? Make a fist and squeeze it for 10 seconds and then relax them, or shake out your hands, sitting on your hands. So doing something that's opposite, using a fidget, right? Doing something else, doing another activity, another movement that's opposite of picking and pulling, is a competing response. Okay. Is in-person therapy recommended for a 6-year-old? And what would effective CBT or similar therapy look like? So, yeah, so as I mentioned before, treatment for a 6-year-old would be the same. It would look very similar as would be with an adult. The issue is that you would just need a lot more parent involvement for a 6-year-old. So, I would recommend in-person over virtual, just because what 6-year-old wants to sit in front of a computer and talk to a therapist? So out of those two options, I would recommend in person. Um, and However, I would recommend in person along with the parent. So sessions with the parents, so you can talk all together. And it's not, it's not CBT work. It's it's comprehensive behavior model. It's CBT, it's DBT, it's ACT, it's HRT. It's like all of these things combined. So again, what would be most effective is to start off with. So therapy would look like tracking. It would start off with tracking. You would help the 6-year-old track and monitor making charts, doing check marks, doing stars, doing stickers, just to learn like what's happening, what the situation is, and where. And then thinking about what strategies that they want to try. So when you're using strategies, again, putting stars, stickers, and using a reward system for using strategies. You are not rewarding not picking and pulling, you are rewarding strategies, no matter if they pick or pull. So it's a big focus on practicing strategies, um, and practicing them together. So, yeah, practicing using a fidget, sure, but it's also practicing doing things like having a conversation talking about your day. How are you feeling? Right? Going over the feelings. Maybe you want to do an art project together. Maybe you want to play outside and do something together when feeling like antsy or bored, right? So helping that child learn other skills of what else they can do when they're feeling a form of distress. I've never shared that I have this disorder with friends and loved ones for fear of being misunderstood and dismissed as it being a bad habit. Yeah, it's not a bad habit. It's not a habit. It's a disorder. I wear makeup as much as possible to hide it from people, even when I don't want to be wearing makeup. How would you recommend sharing this disorder with loved ones? Yeah, um, we've, I believe we've had some webinars also. No, we've had webinars for caregivers, but not necessarily about how to share with loved ones. Um, I believe we have one that will be coming up though, so stay tuned for that. Um, but yeah, this is a common question. It's a common feeling, and I want you to feel comfortable. What's most important when you want to share, talk about it with someone else is that you're comfortable and that you want to share it with them. You certainly do not have to if you do not want to. So make sure that you want to, and that you feel comfortable and do it in a place that you feel comfortable in, whether it's in person, on the phone, right? You can, if you decide to bring it up to a person, you can be prepared with giving them information and resources such as, oh, maybe you want to check out some of the blogs on SkinPick or on Trick Stop. Oh, maybe you want to attend a webinar with me sometime. Right. So it's giving them this opportunity to get more information. Okay. And the more information they have, the more likely it is that they'll start to understand. Um, and it's hard for them to understand if they don't go through it, but it is more than a bad habit. And I think just letting them know a little bit about what your experience is and how it makes you feel, and maybe part of that conversation is, do you want them, like, what is your goal objective of the conversation? Do you want support from them, and if so, what kind of support do you want from them, or do you want them just to know, so you don't have to feel like you're carrying this big secret and this heavy load. So I certainly recommend telling people that you want to tell. Um, if they care about you, um, they're not going to care. I mean, they're going to care in the sense that they're going to feel bad that you are struggling with something, but it's not going to affect how they feel about you as a person. You are not your hair. You are not your skin. You are a whole person with lots of parts to you. And that is what's important. Okay. So I hope that's a little bit helpful. Um, and as far as wearing makeup, again, you don't have to wear makeup, but if that's what makes you feel most comfortable, then go for it. It's all about what's going to help you to feel comfortable and feel good about yourself. Oh, where did you get your fidget ring from? I'm looking for fidget jewelry that is discreet, yeah, and effective for a trick. Um, but would also look nice. You can just look up. I mean, I actually got this. I have a couple, but this particular one I got actually at like a BFRB retreat many years ago. Um, this one I got on Amazon. This one's not my favorite, I can tell you that, but it's still kind of cool and it looks cool. So you can just look on Amazon, look up fidget jewelry, fidget ring. This one is called spinner ring, so you can also just search spinner rings and see what you like. So spinner rings, spinner jewelry, fidget ring, or fidget jewelry, and you should find a bunch of stuff. Okay. Oh, picking skin on face while battling hormonal acne at age 22, female, leaving scars and can't stop. Yeah, please help. So, uh, yeah, acne is a big, acne and hormonal acne, it's a big trigger. It's uncomfortable, right? You can see it. It's just, you can't really escape it because it's there. It's on your skin. It's on your face. And your scars, again, they will heal. They will heal. What can be helpful, and by the way, in addition to just having acne, the hormonal aspect, hormones have a big impact on urges as well. So, one thing you can think about, um, is if you're getting a lot of acne or hormonal acne, again, is to consult with a dermatologist. So there might be a medication that could help with the acne. There could be a topical cream that could help with the acne. So I would consult with the dermatologist to treat that trigger, which is the acne. Some over-the-counter things that you can do are things that I really like, are like little, like the mighty patches or little pimple patches. So certainly you don't want to have, stickers all over your face and when you go out, but it's, a couple, okay. And they're kind of fun. And they can be stylish to have stickers on. But you can also do it when you're just at home by yourself. And what I really like about pimple patches or the mighty patches is that it delivers medication to the area, but it also acts as a barrier so you can't pick that area. So it does both at the same time. So that's why I really like that. The downside to things like patches is some people are more sensitive on the face. So sometimes the patches wind up making you more red and more irritated, and so it doesn't work. So just something to keep in mind. But yeah, I would tackle the acne first with a dermatologist and see what options you have, and go easy on yourself. Okay, they'll heal. It will go away eventually. Um, be gentle and continue doing again the things that you love and that interest you and that make you feel good. Okay. Let me just quickly scroll how many questions we got. Oh, we got a lot. Okay. I often feel like I never get the one. That's true. That is bugging me until they are all gone in that area. I have given up and don't even try to cover it up anymore. No makeup anymore. It is very awkward and super embarrassing when someone notices and asks me about it. What is my best response? Yeah, I don't want to be known for it. Yeah, so a couple of things here. You're right. Oftentimes when you have an urge, it's like, I just want to get that one. I just got to get that one piece, but it's never going to be the case. It is never just the one. Because that one is going to lead to many more because it stimulates the area and you're gonna be like, ooh, that felt good. That didn't feel as satisfying as I thought. I'm going to keep going until I feel satisfied. But none of it is going to feel satisfying. Um, that's part of the disorder. So you're right that um, That's going to happen. You're not going to get the one. It's going to turn into many. Although I think that that's great that you feel like you don't need to wear makeup anymore. And that's great. And that you're feeling, I'm hoping, a little bit more comfortable in your own skin and more confident. Yes, sometimes people bring it up or notice things, but if it's a stranger, for example, I mean, you can tell them the truth if you want to. Um, but usually when people notice, they don't need a whole response. Something simple will satisfy them and they'll move on. So if it's, um, I don't know if this is talking about picking or pulling, but um, basically, if they notice something like, oh yeah, oh, I know I had a breakout, right? Or I know I'm just, my breakouts, I'm having trouble, my skin's having trouble healing. So you don't have to tell them what's going on. The hair, I was like, if you're missing hair anywhere, yeah, sometimes, yeah, my hair seems to grow kind of patchy in that spot. Um, yeah, that's been happening for a while. I know. Thanks for pointing it out. Like, like kind of like brushing it off is completely fine. So minimizing it and brushing it off, and they'll be like, oh, okay, cool. Like, oh, I'm having a bad hair day or a bad skin day. Oh, okay, yeah, I've been there, done that, right? So minimizing it is absolutely fine. Or you can take the opportunity to educate them depending on your comfort level. Oh, I actually have a condition, and it's a disorder where I, pick at my skin or I pull out my hair, and it has a name and everything. And like 1 in 20 people do it, um, and it's really complex and frustrating. Yeah, so an opportunity to start to spread the word. And again, as we spread the word, that shame starts to decrease. Um, and you don't have to be the one known for picking or pulling. Again, you are you. This is just picking or pulling is just one part of you. Okay. Let's see. I too have seen many dermatologists and I'm seeking surgery to close the wound. Can surgery close the hole I created? As a previous question you addressed. I mean, you'd have to talk to the dermatologist. I don't know what the situation is, so I can't really speak to that. Um, for some people, different kinds of surgeries, yes, are an option. But again, I wouldn't necessarily recommend going the surgical route unless you feel like you have managed your urges and are picking less. Because if you go the surgical route, and then you're still picking, it's not necessarily going to do much. So I would consult with the dermatologist, um, and they would be able to better assess because I don't quite know the full situation. Uh, ah, any thoughts on psychogenic itching in an 81-year-old with Alzheimer's? He rejects gloves, finger cots, and he is taking memantine and NAC. Oh, how is he liking memantine? So memantine is actually the newest medication for BFRBs. So there's a lot of potential with memantine, but not enough research yet. So that's why I don't necessarily go for the number one recommendation because there still needs to be a lot of research done on that. So that's kind of exciting that he's on memantine and NAC. Um, you know, as far as strategies, you got to go for strategies that he's comfortable with. So, gloves, finger cots, if he's not into it, it's not going to work. So keep kind of experimenting just with different strategies and seeing what he likes and what he doesn't like. I like to think at the same time, like at 81, when you're older in life, does he want to stop this? Is he still motivated? Is it something he wants to work on? If he doesn't care and that's not the priority, then it doesn't really matter. Is it interfering? If it's not interfering anymore with his life and with his functioning, um, then I wouldn't stress too much about figuring out strategies. It's about what's going to make him the most comfortable and what's going to make him happy. Um, so keep trying, try other strategies and see what he likes. And if he doesn't like something, all right, on to the next. Oh yeah, I've been experiencing this for as long as I can remember, and mosquitoes don't help at all. No, they don't. And I've only recently accepted that I have dermatillomania and want to try to heal myself. After accepting it, I did some research and came across you. I'm also a newly graduated psychologist. Yeah, can you offer any advice on this? I mean, at this point, I would suggest just gathering your information, right? So joining webinars, reading blogs, checking out different websites just to get as much information as you can on dermatillomania and kind of see how you align with that information. And that will help you to know what direction you want to go in as far as working on it with yourself or with a program like skinpick.com or with another professional. So yeah, at this point, I would say gather information, research, and learn about it. Okay. Oh, are you familiar with any aromatherapy suggestions that might help? I am not. A popular aromatherapy people really like is lavender, but again, this is something that see what you like and what you don't like. So if there is a scent that you find calming and relaxing, then use it. So aromatherapy is a nice way to tackle that place strategy that we talked a little bit about, or stimulus control. So controlling and working on your environment. So having nice, relaxing scents sets a very relaxing environment. So it could be helpful. Yeah. So another question just about the scarring. My chest is covered in lots of white dots, which are from the spots that I've picked at for many years. So how can I make these disappear? So again, I would consult with a dermatologist. If you're not still actively picking, talk to a dermatologist and see if there's anything you can do to try to heal that skin. So I am not the expert on products and things of what to do to work on scarring. So consult with a dermatologist and just see what your options are. Okay. Yeah, so for NAC, is it better to split the dose or take all at once, morning or night? So it's better to split the dose, especially if you have, let's say, urges in the morning and urges in the evening, because it only lasts for a certain period of time. So in order for it to be the most effective, it's good to split it up into two. So it's kind of has that effect that 8 to 10 hours or 3 to 5 hours, like right after you take it each time. So take it at a time when you tend to have higher urges. So split it up. I have grinded my teeth instead of picking, and in the last 6 months, oh no, lost two teeth from grinding teeth instead of scratching double-edged sword. Yeah. So like we talked about, sometimes when you try to manage one thing, it pops up in another way. If you haven't done so already, I highly recommend night guards. I mean, you can go to the dentist and get fancy ones, or you can buy them over the counter and get the rubber ones. Um, I mean, I actually kind of like the over the counter, like rubber ones that you do yourself, just because they kind of feel like they kind of feel good to just to bite down and like squeeze. Um, so if you haven't already, try a night guard. Okay. And let's see if we can save some of the other teeth. Oh, I don't know the answer to this one. Any research on the vagus nerve and the parasympathetic system for reducing BFRBs, or studies that link those systems to BFRBs. Definitely do not know this off the top of my head. Please email us though, and so we can try to get an answer for you or find an article and maybe link you to that article. So again, you can email us at support@trickstop.com or support@skinpick.com. Okay, we'll see if we can help you find some more information. Someone is recommending castor oil, organic, cold press, best oil for healing anything. Yeah, castor oil. That's great. Good to know. Yeah, use that castor oil. And it's very accessible too. I love when, things that are helpful are very accessible. Do the hair have to be pulled out and removed from the body for a diagnosis? No. I pull my eyebrows most of the day automatically, but never pull the hairs out. Is there a difference? No. So this is still within the realm of BFRBs. You don't have to, if to be trichotillomania, for example, you don't have to actually be pulling the hair out. What's still, there's another category. So even just like constantly touching or feeling or twirling, right? That's still this automatic behavior. That's still a behavior that's meant for self-soothing and self-regulating. So it's still within the realm of body-focused repetitive behavior. If it's something, especially if it's something that is bothering you or interfering with your life. Okay, that is part of what makes it a diagnosis, is if it's interfering and if it's bothering and if you've tried to stop or interrupt it and you can't, or you have trouble. Okay. Oh, another one. Another vote for castor oil. Thank you. Oh yeah, so my skin picking got worse when I started perimenopause. How can I manage it when it's hormonal? Yeah, so um, I would talk to your GYN. Actually, because there are hormonal medications that could help to balance and regulate hormones. Yes, it is. Urges can be quite closely tied to hormones. So you might find if you're female, your picking and pulling urges might be worse around your period. So same with perimenopause. Also, it's very common for BFRBs to start around puberty, and that's part of hormones. All your hormones are changing. So yeah, so talk to your GYN doctor. Would be the best one for that to see what kind of medication to address hormones would be. Yeah, so is it normal? Is it a normal thing to have more than one BFRB? For instance, I pull eyelashes and also find myself clenching teeth. Yep, squeezing bum muscles, chewing nails, and or clenching fists. Yep, completely normal. Oftentimes when you have a BFRB, one BFRB, you will have another BFRB. I don't know what like the percentage is, but yep, unfortunately, if you have one, most likely you will have another. Um, Not necessarily. Some people just stick to one, and that's great. That's great. Or sometimes the urge might kind of start poking through as another and not kind of become you might have like one main and one like little. Um, but yeah, it's completely normal and quite common. Oh, so someone is recommending they have a new cream, 1.5% noxolitine phosphate called Obzalura, rebuilds skin growth, but has no anti-itch. So here someone is answering a question of what they recommend um, to help with skin growth. But again, this is something I'm imagining you're going to need a prescription for. So you'd have to talk to a dermatologist. OPZELURA, rebuilds skin growth, but has no anti-itch. I think I do have a list of creams to help with itchiness. So if you are looking for something to help for skin for itchiness, again, email us support@skinpick.com and I can get that list that I started to make for you. It only addresses that itchiness. Where did I get this necklace? I have no idea. Um, you can probably just also find it on Amazon. It's just a magnetic necklace or magnetic jewelry if you search. Yeah, thank you. Yeah, so does does Wellbutrin, right, help treat skin picking disorder? So no. That's the short answer. No. There is no medication to treat skin picking disorder or hair pulling disorder. The most commonly used and most recommended is an NAC, an acetylcysteine, but there is no FDA approved medication for skin picking disorder. If you have another co-occurring disorder, a medication like Wellbutrin, for example, could help, but that's going to address other symptoms that might impact your urges. Okay. Yeah, what is the correlation between depression and tricks? So again, depression is a common co-occurring disorder. Just because you have trick does not mean you have depression. Just because you have trick does not mean you have anxiety, right? Just because you have depression does not mean you are going to get trick. Um, but yes, they commonly go together. And it is understandable why you're feeling sad, depression, you're having trouble regulating your emotions, you don't feel good. And trick is a way of self soothing, right? So it's going to try to soothe yourself when you don't feel good. When you have depression, you have very low energy, right? You might feel more tired. And when you have low energy, it's harder to manage trick. When you're tired, who wants to put forth that energy to manage and use strategies. So it definitely adds another layer, um, but is very common. Okay. Oh boy, we still have a lot of questions, and I see we're closing into 1:30. I'm going to try to skim through this. Yes. So pickingme.org. Oh, yep. Yep. I almost said that too when that question came up about tracking and logs, but I didn't. But yeah, pickingme.org, it's run by Lauren. Her name is Lauren, and she is wonderful. And she has a lot of really great resources. So definitely something to check out. She's got great logs there and examples of how to log. Um, and she's got like tons of resources. So she's a really good person to connect with. That's pickingme.org. The organizer is her name is Lauren. Um, oh, another vote for castor oil. And also biotin. Yeah, I tend to like this person is saying 10,000 mcg's biotin helps. Oh, vitamin E. Oh, that's the other cream I really like for scars. Vitamin E is really nice. Biotin, I like to have biotin. You can get like shampoos with biotin. Again, it just makes you feel good. I think you're right, the oral biotin is more effective than the shampoos with biotin in it. But again, it's part of self-care. Oh, congrats. My eyebrows and eyelashes are growing for the first time in 8 years. Exciting. Congrats. Like to hear that. Um, Okay, I'm skimming through some of the find the short questions since we're kind of at time. Um, I love how this is like a little bit of a teamwork. Another vote for castor oil, but this one castor oil with rosemary. Yep, thyme, lavender. or cedarwood essential oils. Rosemary is my favorite, 100% aloe vera, great. Aloe vera is also great for healing. Yep. And also comfrey salve. Yeah, great. Thank you. Oh, that's for growing hair. Castor oil with rosemary, thyme, lavender, cedarwood, essential oils. Thank you. Uh, okay. Does your general practitioner prescribe memantine? You could ask. I do tend to recommend a psychiatrist, um, just because a psychiatrist is like focused on medications only, and can really help you manage medications. A general practitioner may not be as much of an expert, and they're kind of general, so they're a little bit of a lot. So I would recommend more of a psychiatrist. But if you don't have one, a general practitioner is a good place to start. No harm in asking. Let's see. Okay, go back. I don't think I'm gonna be. We do have quite a bit more questions left, so I don't think I'm going to be able to get to all of them, or the rest of them. And, yeah, so, and I'm just kind of skimming through them, and some of the ones that are left are a little bit of a repeat or overlaps with some of the things that we've already talked about today. Uh, yeah, so what I'm gonna do, I was like looking maybe for like one last question. It's hard to choose because they're all really great questions. Maybe I'll maybe I'll end with this one. One thing that helped me when I was in a very intense popping mode was covering my mirror in sunscreen. Oh, yeah, so that it blurred the details of my face, but I could still see enough to floss and brush my hair. Currently, I use a nightlight in my bathroom to avoid scanning. Lighting and nighttime is a trigger for me. Yeah, I love this idea of putting sunscreen on the mirror. I've had people leave the shower running so it fogs up the mirrors. So that could be a helpful strategy. What I really like is if you're covering the mirror, to cover it with like something that's sheer, a nice sheer fabric. What I like about that is you can still see, again, you could floss and brush your teeth, and brush your hair, but you won't be able to see the details. So I do recommend a sheer cover to cover your mirrors. And I absolutely agree. Lighting makes a huge difference. So, especially the bathroom lighting. So keep the bathroom light off if you can, or put like some mood lighting. Mood lighting in the bathroom is really nice because it sets that relaxing environment, and it gets rid of that harsh lighting so you can't see well enough. You can't see those details. So thank you for that. Um, yeah, go out there and try putting sunscreen sunscreen on the mirror. I love that idea. And if there are questions that I you feel that I oop, that I oops, hold on a second. Did I don't know. I think I messed that clicking up. So if there are questions that I did not get to, which I know there are because there are lots still here, please email us again at support@skinpick.com, or support@trickstop.com, and we can just email you some responses if you feel like you need a little bit more and you have further questions. Um, you're also welcome back to, the next time we do a Q&A session. We do them somewhat regularly, about every other month. So come back if there are more questions. So I hope this was helpful for everyone. Thank you so much for joining. And boy, and sticking with it for like an hour and a half. So I hope this was helpful and looking forward to next time. Okay. So thank you so much, everyone. Oh, thank you for the heart. Oh, lots of hearts. Thank you. Thank you guys.